average, 1 American dies of a blood clot every 6 minutes. Lynn Campbell of Pittsboro, Indiana is with us today on World Thrombosis Today to share her inspiring story. And she's joined by Dr. Magdalena Lewandowska, who saved her life. Ladies, welcome to the show. How you doing?
Thank you
Good.
so much for having us.
Thank you for being here. Now, Lynn, you have a very inspiring story about your journey with a blood clot, potentially a story that could save another Hoosier's life today. Share a little bit about that with us.
Well, in 2016, kind of wasn't feeling so hot in the fall, and it went on literally for a month. Shortness of breath, sweating, thought I was always hot, going, what's going on? Fast forward to Thanksgiving, Circle of Lights, downtown Indy.
Sure.
Walking from St. Elmo's back to the Circle to watch, I had to stop and catch my breath. Had a down coat on, was like, okay, something's going on.
Yeah.
But felt fine. It went away, went home. Now we fast forward to Christmas Eve.
Okay.
And same kind of experience, except I couldn't get from one end of my house to the other.
Wow, okay.
So called a friend, RN, made my way through the ER, or to the Minute Clinic. Then I said, well, I have to go to the ER.
Yeah.
And went in, trying to get up the ramp into just walk into the hospital. And when you say at the hospital, I can't breathe, they take that very seriously.
Yeah.
So long story short, in the ER, and I spent Christmas Eve with a great bunch of nurses, and I was told I had a pulmonary embolism. And I had asked if I'm having a heart attack, and they were like, oh no. And when you don't know what you don't know, I'd never been in the ICU, and they were very kind and very judicious about what they were doing, and for me not to move, and a lot of things that I just didn't know about.
Yeah.
And spent 7 days there, and into blood thinners, and now all of a sudden I met a whole lot of heart doctors, a pulmonologist, thrombosis and hemophilia doctors that I wasn't aware of. And as I've learned more, I had 3 warning signs, 3 warning events prior to all of this happening that I just didn't listen to.
Yeah, yeah.
Went through a 6-month screening, ended up with what they call unprovoked. So I didn't have any blood disease, I didn't have cancer, I didn't have any of the normal types of things that could be associated or reasonings why you would have a pulmonary embolism. And so they took me off all the medications and said, let's watch, let's keep going. And 90 days later, I reclotted again.
Okay.
But I knew the signs, and I literally had an overnight bag now in my truck, went to the ER, told them, in and out 3 days. So that's kind of, and now that's been since 2016.
And you're on the road
and
to
I'm
health.
still here.
Let's turn to Dr. Lewandowska. So what are some ways that we can prevent these? We got about a minute left.
Yeah, I mean, I think awareness is probably the most important thing. So today, actually, October 13th, it's World Thrombosis Day, which is actually Dr. Rudolf Virchow's birthday, who was the pioneer of thrombosis and helping us understand it. So I think being aware of signs and symptoms of blood clots is of paramount importance for Hoosiers. So things such as leg pain, leg swelling, or redness, any chest pain or shortness of breath, or feeling that your heart is beating really fast. And also being aware of preventative strategies. For example, when you travel long distances, getting up and walking every 2 hours at least, staying well hydrated, avoiding excessive amounts of caffeine and alcohol around those periods, and knowing risk factors. So things, Ryan, such as, surgeries, really big injuries, especially that affect the veins of the legs, being on hormones. So either oral contraceptive pills or hormone replacement therapy for women, or pregnancy, for example. And those are just a few, but really anything that causes immobility or sometimes even hereditary risk factors. If there's people in your family who have had blood clots, that could potentially raise your risk. But if there's any questions or concerns, I think the important thing is to reach out for help and contact your primary care doctor. and the other physicians who care for you in order to ask any other questions.
Ladies, thank you so much for joining us today on a really important conversation about our health. Lynn, we're so glad you're doing well. Dr. Lewandowska, thank you for your knowledge and insights.